The services we offer at the Comprehensive Breast Center at MedStar Good Samaritan Hospital include the core basic medical services, which are breast imaging and diagnostics, pathology, radiation oncology, medical oncology, and breast surgery.
Out of 100 women that we see, approximately 10 will come back for additional views. Of those 10, 6 will be told to come back next year for an annual screening mammogram. 2 will be recommended for a short-term follow-up, and then 2 will then be asked to return for a biopsy. Once we have a formal diagnosis of breast cancer, then we refer to our team here with Dr. Farha as the lead to get patients in to again get seen by a multidisciplinary committee.
So very early on in their diagnosis of cancer, we sort of lay out a map of what's likely to happen and how everyone is playing a role in treating that particular patient. They have the opportunity to ask questions, and it relieves a lot of fear and anxiety that patients might otherwise experience until they see the next clinician, the next medical oncology appointment or the radiation oncology appointment.
Multidisciplinary approach to breast cancer treatment optimizes the outcomes because it takes every single possible treatment option into consideration. So more accurate review of records, more accurate review of imaging, pathology. Everybody makes suggestions how to best treat this patient. So putting everything together, it's not just one perspective, not just one opinion of a physician. It's a collaborative approach.
I connect with the patient. I help schedule their appointments. I make sure that they don't have to do anything. They just show up for whatever I have scheduled for them. They are already overwhelmed and they don't have to do anything. That they have someone there to help them get through this hard process. There is a light at the end of the tunnel, and as long as they keep thinking positive, they're gonna get through this journey, and we're gonna be there to help them.
There is no one-size-fits-all for treatment of breast cancer. Every breast cancer can be different. We have to be very comprehensive about diagnosis in terms of making an accurate diagnosis, precise staging, to make sure that each patient gets the tailored treatment and personalized care that they need. Mortality of breast cancer has declined by 43% since 1989 to 2020. We have now better treatment options. We have better chemotherapy regimens. We integrate targeted therapy, anti-hormonal therapy. We have now immunotherapy integrated to our treatment options. We have CD4/6 inhibitors. These are all contributing to better outcomes. Also, we have better supportive care. So we can control the side effects in a better way. We have new medications for that. So people are more likely to tolerate their treatment and they are more likely to complete their treatment.
So at MedStar Good Samaritan Hospital, we do have a newer linear accelerator called the Halcyon, and it treats literally twice as fast as more traditional linear accelerators. It also has some capabilities which people who require radiation not only to the breast, but to the regional lymphatics can get treated in a third of the time that they would in more traditional places. So that's a huge benefit for the patient in terms of comfort, but also because they're not laying on the table as long, they're more likely to stay in the exact position that we want them in, and so the treatment can be delivered more accurately. At the end of everybody's radiation treatment, there is a bell that we offer the patients to ring. Most patients want to ring it, and they're very happy. A lot of times they bring their family, and it's quite an emotional thing. It symbolizes the beginning of usually survivorship. Their treatments are completed, and now they're going to go on to surveillance, seeing myself, seeing medical oncology, and seeing surgery, rather than in treatment mode, but into survivorship mode, where surveilling them, make sure that everything's going okay.
To start with, most diagnoses are made through minimally invasive approaches. We rarely ever have to take a patient to the operating room to make a cancer diagnosis or to rule out a cancer diagnosis. These are done with ultrasound guided needle biopsies, stereotactic biopsy, MRI guided biopsy. So all these eliminated the need for a trip to the operating room. Breast conservation has been shown to have the same survival outcomes as mastectomy in appropriately chosen patients. To do that, you really have to have your handle around the extent of the disease in advance. This allows most patients to go home the same day, and most patients experience very mild discomfort, to be honest with you, and they tolerate the surgeries very well.
Patient navigation is very important during this process. The patients need to feel that they have someone that they can contact and talk to, just to listen, and someone who will be there for them to schedule whatever needs to be scheduled, and they won't have to worry about having to do that. They know that there's someone there for them, helping them. We also have an app that they can respond and text and answer any questions or send me questions that they may have. They can look at their appointments. They can look at their profile and see their diagnosis. They can chat with the physicians and the other staff members, and they will be able to add family and friends to the app. The team that we have here at MedStar Good Samaritan Hospital is a wonderful, caring, loving team. They are wonderful with the patients, the staff, the technicians, everyone that is involved with their care is just loving, and they care so much about their patients.
It's getting to meet people on a very intimate basis closely for usually 4 to 6 weeks. We see each other daily. I don't think there's another specialty in medicine that has that intense relationship daily for a long period of time over a very serious condition.
I love my day-to-day work mainly because of the relationship and trust and bond I make with my patients. We celebrate small wins. If a tumor responds, imaging shows shrinkage of the tumor, we celebrate it together. It's very rewarding.
Radiology is typically one of those specialties which is in a room and reading cases, and you don't necessarily get to see the impact that you have on an image interpretation. I have patients who I've diagnosed years ago who could still come to say, hey, you're the one who found my breast cancer. So it's kind of awesome in that way.
I love doing what I do. I love when the patients come in and see me 5, 10, 15 years down the road that say, thank you for being there. Thank you for helping me get through this. It is so wonderful, and I love it.
We feel like their family, actually. Patients are very close to us. Seeing our patients who had really low chances of surviving, seeing them 10, 15, 20 years later keeps us going and makes us continue doing what we do.